Hello. Welcome. You have arrived at Pearl Pediatric Therapy. My name is Carissa Tracy. I'm a pediatric physical therapist, and I do not call my friends and family if you see this and panic. I am not pregnant, but I have a helper today to help me demonstrate. Had a friend reach out. She's in a ton of pain. And so the topic for today is sciatica and pregnancy. I was sending her a bunch of things to do, and then I thought, chances of someone else needing this today are extremely high. Unfortunately, sciatica is very common in pregnancy. Ladies, I've been pregnant before, and if you have, you've probably experienced it. Sciatica in a nutshell, there's a nerve running down the back of your leg, starting up high. You can get buttock pain all the way down your leg. And essentially, when you're pregnant, things are starting to move, things are starting to swell, things are starting to get squished. And what happens is that nerve that runs down your leg like a rope gets pinched or squished in certain areas. And so it'll send zingers and pain down your leg. So our goal of these exercises is to kind of open up the space around the nerve. So if you can visualize your nerve going through a tunnel, in sciatica, the tunnel is small and it is pinching the nerve, and the nerve is not happy. And if mama ain't happy, ain't nobody happy. Am I right? Okay, so I have a helper. Again, nobody call my husband, nobody call my friends and family. This is a pillow, but I want to have something here so that visually you can see what it would look like, and also to remind myself to move like I'm pregnant. You have to be very careful. Everything is loose and you can injure yourself, okay? So the first exercises we're gonna do are gonna be on our hands and knees. So I'm gonna move this down. Where's my mat? There we go. Okay. And I've got my notes here because I wanted to show you guys, I think about 10 different ones. Okay, so y'all can see me okay. So get something padded for your knees, but the first one, to help you relieve sciatica pain if you're pregnant, you're gonna come on your hands and knees, just a neutral back and your head in line with your spine as best you can. And what you're going to do is take your knee and you're going to do small little circles, okay? You're gonna be moving your knee forward, to the side, and back in that direction. So, gentle spine and head, and you're just gonna be doing little circles, okay? It's very, very gentle. Therapists, this, as we know, is the pendulum motion, okay? We're trying to loosen up that area where the nerve is being pinched. If you're doing the other side, you're gonna go forward to the side and back. So very little circles, okay? You can do those circles for 2 to 3 minutes, okay? They're meant to open up that space. The next one you can do right after it in the same position. You're gonna extend a leg out so that your toe is just gently touching the floor, and you're gonna wiggle. Wiggle that leg. Okay, neutral head, neutral spine, and just wiggle. You want that leg that you extend to the back to kind of feel like a rag doll. Just let it hang, let the full weight of it hang, and wiggle. 2 to 3 minutes on each side. Put it out, let it kind of hang, wiggle. Okay? Those two should relieve the pressure and are good starting ones. I have a note on here, breathe, breathe, breathe. Okay? You can get winded when you're pregnant sitting still. So y'all take deep breaths as you're doing those. Okay, the next two that I want to show you guys. Oh, there's one more in that position. If you do yoga, you know it as the child's pose, but you want to make sure you open up your legs, you guys, so your knees are apart and your belly can fit between your legs, and you're just going to settle back. Deep breaths here. Okay? If you can get even more of a stretch, go for it. It depends how much pain you're in, and it depends how big your belly is. Okay? So those are the 3 to do on hands and knees. Now I've got a couple on the back that I want to show you guys. So be careful, kind of going to your side. Make sure you're careful, turning around. No quick, sudden movements, okay? Okay, the first one is a pelvic tilt in this position, okay? So what I mean is if you take your pelvis and you think about headlights shooting out from your hips to the ceiling, you want those headlights to go above your head, kind of behind you, so you're just going to tilt. Your pelvis actually stays on the ground the whole time. Okay? So your pelvis stays in contact, but if you can imagine headlights, you're changing your headlights to point behind you. If I had lights coming up, they're going to go that way. Okay? This is, again, to give relief back here where that nerve is getting squished for that sciatica pain. Now, if you're not having current sciatica pain, but you want to be preventative, you can actually go ahead and bridge up. Okay? But if you're really flared up, you just want to be doing kind of this tilt motion, the pelvic tilt. Okay? So my job in this video as a physical therapist is to give you guys ways to open up that space, to calm down that nerve, to bring symptom and pain relief. Okay? So if you're in pain, I would stick to the pelvic tilts. If you're trying to be preventative, go ahead and pelvic tilt and then make it a bridge. The hardest way would be to put a ball between your knees and do 3 parts. Squeeze the ball, pelvic tilt, and bridge. And that would be more if you're not in pain at the moment. That would be a good preventative thing. Okay? Let's see if we got everything on our back. Oh, I do like this one. If your knees are to the ceiling, gentle opening like butterfly. I really like it in this position because it kind of just turns everything off in your buttock area and it just lets it kind of relax back there, okay? Again, if you were not in current pain and just trying to strengthen, I've seen women put the band, the TheraBand around their legs, and then you're strengthening the outside of your hip to prevent the sciatica. But if you're currently having symptoms, just gentle opening, just again, opening and loosening that space back there is helpful. Okay? Now I've got 2 more stretches I want to show you, and they're on a chair. So let me bring this in front here. Now you guys will hear physical therapists talk about the piriformis. That's the muscle that kind of squishes the nerve, and it's back here in the booty, and it kind of runs across on a diagonal back here, and the nerve runs down like a rope. So essentially, the sciatic nerve is getting squished by that muscle that's fanning across, okay? And so that's what we're gonna stretch. You're gonna cross your knee where your ankle is on the opposite leg, and I actually already feel a stretch, and I'm not even pregnant with sciatica. But if you are pregnant with sciatica, this might be enough. Just this position, you might feel a tremendous stretch. If this is too much of a stretch, you can even slide out your front leg, and essentially it lowers your leg down, so this would be like the easiest. If you are in really bad pain, you might even have a friend, a partner, a spouse, somebody kind of help you lift up that leg, and you want to relax it on the opposite knee. So if you can handle this, slide your heel towards you. That's more of a stretch. This is more of a stretch, more of a stretch. Find the angle where it's just right. And if you need to even lean forward, some women won't feel it until they lean forward. Okay? What it looks like the other way, of course, is crossing this way. Okay? So if you're going to do that stretch for the piriformis, you want to hold it at least 30 seconds. Make sure it's actually 30 and you're not counting so fast because you're in pain that it's 10. Make sure you hold it and do it a couple times each side. I say 3 to 5 if you can handle that stretch. We've got some questions coming in, so let me say hi. Courtney, Whitney, Rachel, y'all are here. So I was inspired to do this topic today by a dear friend. So I really hope that this video helps other women. If you have sciatica in pregnancy, you are not alone, but do know that until you give that nerve an open tunnel and room for it to be, you are going to get those zingers in pain. So this whole video is meant to loosen the space where the nerve is running through. Okay? Y'all have questions? Send them in. There's a little bit of a delay, but y'all can go ahead and send questions, okay? So if you have sciatica, please talk to your doctor. If you are currently pregnant and you are really struggling with it, your doctor needs to be aware. I also want to make this a cool open forum for those of you, I'm a physical therapist myself, so I have tons of friends that are physical therapists on here and that watch these. If you're watching it live, say hi, say live, ask a question. If you're watching it on replay. And then if you are a physical therapist who helps women with either prenatal or postpartum care for physical therapy, go ahead and drop your name and the city that you serve down in the comments, because there will be people that will need this. And I am in New Braunfels, Texas, and I help the littles all day, and I know a lot about the mamas, but there are other therapists that will do prenatal, the whole prenatal series. There are pelvic health PTs that are incredibly knowledgeable. There are orthopedic PTs that treat women all the time with these kinds of symptoms and concerns and pains. So if that is you, if you are watching this on replay, hey, put your name in the comments. Let people know where you practice. Let people know, hey, I'm a PT and I can help you with sciatica if you are pregnant. If that is you, put your name and your information down there, or city or a clinic to call, so that women that are having this issue have a place to go. Because these videos are all about resources, okay? I hope this has been helpful. Amanda says, you're welcome. Oh, I hope that this is helpful. I hope that she's finding some relief. You guys, I hope that this helps. I have some other videos that I actually have planned for today, and I might get to them in a little bit, but this request came in, and it's important because anytime women are in pain, we have got to help them out. Am I right? So there's one more thing I want to say about a woman who's pregnant. If you find yourself on the floor for any reason, for me when I was pregnant, I was on and off the floor with treatments all the time, and I will tell you, the most painful thing about pregnancy was this position. Having to split my pelvis and stand up or lower down. So y'all, please be careful. If you are pregnant, that pelvis is so pliable. Please be careful with keeping yourself out of this split position as much as you can. It will create pain. For me, like I said, I had to do it for work. I hated every time I had to rise and lower, and I did my best to, if I could, I would treat like this, because this is, you know, if I was on a rolling stool, this is a symmetrical position and it allows baby to kind of be forward. So if you are an active working mom, or you are at work, or really anywhere, you're in the community and you're in pain, try to make yourself symmetrical, try to give baby room, and you want your pelvis, if anything, if this is okay with you, I don't know what your work position is, this is a good natural position, but do not let your back arch. That will create pain back here. Okay, so you want baby to have room, but don't let yourself arch. That's not what I'm suggesting, okay? Neutral spine. These exercises are good whether you have current pain with sciatica or you're trying to prevent sciatica. You can do those kind of more advanced ones that I showed. Any further questions, I'll let you guys go. And if you watch this on replay, please hit replay and send your questions in. This is Carissa Tracy signing off. I'm a physical therapist and founder and owner at Pearl Pediatric Therapy. Again, if you are a physical therapist friend of mine and you can help people with this issue, pregnant women with sciatica pain, comment below, put your information, tell them what city you practice in so that they can go to you, someone who knows this and can help them and bring relief. Happy Monday, everyone. Love you guys.